Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. I'm Dr. James Machino. Our topic today is osteoarthritis. It's also known as degenerative arthritis, and it's primarily an age-related condition, and virtually everyone has some osteoarthritic changes in their joints by the age of 60, unless they take some precautionary measures that we're going to talk about today. Now, for a long time, no one really knew how osteoarthritis developed. We thought it was just sort of, a wear and tear problem on the joints. But we realized later that that's not exactly true. Some people with a lot of wear and tear in their joints are spectacularly good. But in the 1980s, we saw some biochemical research and genetic research that showed us where a lot of the osteoarthritis comes from. And so there's a hallmark feature that occurs after the age of 40, and that is that the joints stop making optimal amounts of a molecule called glucosamine. You've probably heard about glucosamine, but the body makes glucosamine because it's an important component, a raw material needed to make joint cartilage. So after the age of 40, what happens is that the cartilage is now breaking down at a faster rate than the body can resynthesize it because of lack of glucosamine. So you get what's called cartilage erosion, and the net result is that the bones start to get closer together. So when you have an x-ray taken, you see that your bones are getting closer together. We call that narrowing of the joint space. And that is the first sign that osteoarthritis is starting. Then we realized in more recent years that on the inside of our joints, we have like this saran wrap. It's called the synovial tissue. And there are certain white blood cells there called monocytes. And as we get older, those monocytes secrete more inflammatory chemicals, and we become more prone to inflammatory changes in our joints in the aging process as well. So what I want to talk to you about today are sort of the 4 pillars to prevent these osteoarthritic changes from occurring and how to best manage osteoarthritis if it does start to occur. So pillar number 1 is this. After the age of 40, people need to take supplementation with glucosamine. Glucosamine supplements have been shown to substitute for the glucosamine the body can't make for itself anymore. The body can take that glucosamine and help to make critical components of the joint cartilage to stop joint cartilage erosion from occurring. I will tell you something, there are no drugs that can do that. Only glucosamine sulfate has ever been shown to actually do this. It'll help to stabilize that joint cartilage. Some people take glucosamine with chondroitin sulfate. I will tell you that's a mistake because chondroitin doesn't even get absorbed. Less than 11% of it even goes from the gut into the bloodstream. And this leads us to pillar number 2. Pillar number 2 is that natural anti-inflammatory agents like quercetin and MSM and bromelain can really help to decrease the inflammatory response by those white blood cells that are producing the inflammatory chemicals. So when you take a glucosamine supplement, it should include some of these natural anti-inflammatory components, quercetin, MSM, and bromelain as an example. You also need an anti-inflammatory diet. That means less high-fat animal products with the exception of fish, and you have to have the right vegetable oils. That's all explained in the text below. The third pillar is going to be chiropractic care. I will tell you that chiropractic care is a phenomenal thing to undergo periodically, because what chiropractic does is it corrects the postural faults and the occupational stresses that we're all exposed to. We all become victims over time of the things that we do each day. Our joints slowly get locked up, they start to seize, we have restricted motion, and it occurs very slowly over time. And then you get with that muscular tension and muscular contractures and knots. And it can all result in sort of pain, restricted motion of our joints, and things start to feel tight. You can see it when you're walking down the street. You see an older person who's rigid and stiff and they're not moving so fluidly. And then you see someone younger who has the natural fluid motion of a younger person. The older person has allowed these joint fixations and muscular tightening to sort of creep up on them over time, and the net result is that they get rigid and stiff, restricted motion. They're unable to do things they could do when they were younger. And you also become more prone to joint pain and arthritic changes and acute flare-ups of back pain and shoulder problems. Your elbows start to hurt, your knees are sore. And so you get these more serious joint problems if you don't have the preventative things in place. So what does chiropractic care do? It restores the normal joint function, relieves pain, strips out the muscular knots, safely realigns the joints, corrects the fixations that are causing the joints to get stuck and locked in the first place, helps to stop the degenerative process that can lead to cartilage erosion, and keeps you more functional, and that's really what you want. So those first 3 pillars, glucosamine, natural anti-inflammatories, and chiropractic care, what's the 4th pillar? the right exercise program. After a chiropractor examines you, they can get you on a program that makes the most sense in terms of a stretching program, strength training program, and also the right endurance program for general fitness and the prevention of diabetes and cardiovascular problems. Here's the big problem I have, is that the medical management of osteoarthritis primarily involves anti-inflammatory drugs or pain-killing drugs. Drugs, these non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, indomethacin, Voltaren, Celebrex. In a recent review paper by Robert J. Adams published on September 27, 2011 in the Biomedical Central Journal of Family Practice, what they showed is that those drugs, they don't just cause stomach irritation. If you've taken aspirin and ibuprofen, you know it can cause some stomach upset and discomfort. But it's actually causing erosion of the stomach lining, which can lead to ulceration and internal bleeding. You may not know this, but 10 to 20,000 people in the United States every year die simply from internal bleeding related to aspirin, ibuprofen, and these types of non-steroidal anti-inflammatory drugs. But this paper went on to highlight the fact that the frequent use of these drugs is now also linked to congestive heart failure and high blood pressure, and damaging the liver. So there's a greater risk of liver failure, damaging the kidneys, leading to kidney failure, the need for dialysis. Adverse drug reactions are the fourth leading cause of death in the United States. That's been well established. But what people don't often know is that it's these anti-inflammatory and pain-killing drugs that actually cause the greatest number of deaths as adverse events related to drugs compared to all other classes of drugs. And acetaminophen is just as guilty. It's not an anti-inflammatory, but it is a painkiller. Acetaminophen is strongly linked to liver damage, leading to liver failure, the need for liver transplant, kidney damage leading to the need for dialysis later in life or a kidney transplant. These drugs are not candy. Now, I'm not against the use of drugs because in the short term, some of these drugs are necessary to control pain and inflammation. I totally understand that. But drugs don't address the underlying cause, and it's best to reduce your reliance on these drugs over your lifetime. How do you do that? After the age of 40, with a glucosamine supplement that has anti-inflammatory herbs. You need the right anti-inflammatory diet, periodic chiropractic care, and the right exercise program. So, many family doctors and rheumatologists, orthopedic surgeons fail to explain to patients the importance of diet and supplementation, the role of exercise, the fact that chiropractic care can be useful in cases of osteoarthritis. I'll tell you, it's very unfortunate, it's very disappointing, and it's wrong because these things can make a very big difference. The science demonstrates that. There are clinical studies to prove it. So I've summarized the diet and supplementation program for osteoarthritis prevention and management in the text below this video. Please pay heed to the advice and ask your doctor of chiropractic to help you implement these strategies based on their examination findings, because I know it'll make a huge difference for you. So I hope you found this research update to be helpful and informative. If so, feel free to share it with your friends and your family. And I will see you next time, and thanks so much for watching.